Thank you, Minister. We're now going to begin rounds of questions, starting with the Conservatives for 6 minutes. Dr. Ellis.
Thank you very much, Chair. Thanks, Minister, for being here. You talked about access to primary care. Can you tell the committee how many Canadians do not have access to primary care?
It's high. It's, of course, regionally dependent, but far too many Canadians don't, and that's why we're working on these agreements.
Across the country, Minister, how many Canadians don't have access to primary care? You know the number.
Well, it varies, and sometimes it's difficult to know, actually, because the circumstances are too opaque. We're missing a lot of the data that we need in health to be able to give precise numbers. So they're best guesses, but the number is too high, and I've seen a lot of numbers all over the map.
Minister, you're too afraid to say the number because under your watch it continues to increase. Is that not true?
Well, no, actually. Under the last 10 months, we've made huge progress. On my watch as health minister, we've signed 26 agreements, moving forward with $200 billion in funding. And I think you wouldn't find an association or an organization that represents nurses, doctors, personal support workers who isn't saying we're making tremendous progress and have over the last year.
Well, it's interesting, though, Ministers, because you've refused to give a number, but now you're telling Canadians that you've made progress. If you can't even count the number of people, how can you tell that you've made progress?
One of the things that we did in the agreement that I think is critically important is put common indicators across the country and prioritize health data so that we don't have that level of opaque nature to our health system. I think that we have provincial and territorial governments. It's essential that we have common indicators so that we can have clear and concise answers to these questions. So that was one of the things we built into that.
Let's just give a number. How many Canadians do not have access to primary care? Just a number. How many million?
Too many. We don't know the number.
That's not a number.
Well, we don't know the number. I've tried to explain that we can't. It's an unknowable number because,
Minister, except you.
Well, if you know the number, then say it. And where does it come from? Can you cite the source?
Thanks very much. Maybe I'll try one of your associates here. Mr. McDonald, do you know how many Canadians don't have access to primary care?
Per the minister's comments, I mean that's information that's being collected pursuant to the agreements that have been signed.
So here we are. We have, and maybe Madame Boudreau, could I ask you the same question? How many Canadians don't have access to primary care?
Thank you for your question, Mr. Chair. I wouldn't be able to add anything further.
So what you're telling me is we have 3 officials, including the Minister of Health, who have no idea how many Canadians don't have access to primary care. Wow. This is going to go a long ways to helping Canadians then. How about this, Minister? Semaglutide. Why is it not on your list of medications?
Well, what we did is create a base. So one of the things when we're negotiating with provinces is to say this is just a floor to make sure that we have for those who are uninsured or underinsured, that we have a floor. So, we're absolutely open to both the committee's comments and negotiations with provinces to be additive. I would say that the list that you see is an absolute minimum, and I would expect there will be no final list that doesn't include more. So if there's things you think should be on that list, I'm actually quite interested in having that conversation. Hopefully it would mean you support the legislation.
Yeah, I don't think we need to worry about that because it's bad legislation. It's bad for Canadians. Can you tell Canadians how long it takes in Canada on general from first launch to public reimbursement for a medication?
Well, again, varies by province, but again, I would take it back. I hope that you won't just summarily reject the idea of helping people who are uninsured get medicine. I would ask you, if
Minister,
not this plan, what is your plan, sir? So there's 1.1 million uninsured Canadians.
I believe,
could you tell us what your plan is to insure
question,
those folks? To make sure that people who don't
Minister,
have medication have medication.
You'll have your chance
plan,
to
sir?
ask me questions at some point when you're sitting in the opposition. But can you tell all Canadians the number of days from global first launch to public reimbursement? How many days in Canada?
Again, when you're talking, depends on the medication, depends on the jurisdiction. But I would put it back to you. If you were going to vote against something, my preposition would be that you have to explain what you're going to do in its place. So if you have all of these folks who have no insurance and no medication, it's a pretty simple question to ask back, what are you going to do in its place? And you say you have no answer, then I would say, why are you voting against this?
No, I didn't say I didn't have an answer. You're the person who's given me, I've asked you 2 questions now, simple numbers, which you do not know the answer, nor do your officials. 3rd question, simple number, let's try another one. percentage of new medications available by OECD country, 460 new medicines launched from 2012 to the end of 2021. How many are approved in Canada? What percentage? Just the percent.
Yeah, I'll just be straight with you. This is like, what is your purpose? Like, what are you trying to ask? Like, I understand you're trying to play a gotcha game here instead of, I'm trying to talk about people who don't have medicine, and you seem to be lost in some kind of partisan, like, weird thing that you're doing. Like, do you have a plan for people to get medicine, or do you not?
Minister,
and is this an attempt to obfuscate the point that you don't have a plan?
You're trying to do, we can talk about those. But what we're asking is simple questions on behalf of Canadians when we know.
No, I'm just curious. What's your point? Do you have a point?
I have lots of points. Well, let's start with the first point. You have no idea what you're talking about. Second point is Canadians wait the longest time in OECD countries for approval of medications, which you clearly have no clue about. We're back to that again. Sadly, the last time you were here, you had no clue, and you remain clueless, obviously. The percentage of new medications available in Canada, 44% of 460 medications. What that means is despite the fact that you want to go out and announce things that are untrue and not even happening, the system that you have, the regulatory system that you, sir, have control over, is failing Canadians. You had an opportunity to change that. You have chosen not to. You have chosen to attempt to keep yourself in power with your NDP costly coalition partners by creating something that already exists at provincial levels.
That's your time.
Thank you very much, Chair.
If you want an answer, we'll. Okay.
I think I've already provided the answer, Chair.
Hopefully, one of somebody else will allot you some of their time to respond. I think that would be the fair thing to do. Mr. Yakfi now for 6 minutes, please.
Thank you, Chair. Welcome, Minister. I think it's shameful, the behavior we just saw from Mr. Ellis, where we're trying to have a thoughtful conversation about a very important piece of legislation that is going to make an incredible impact on the lives of Canadians. You don't have to agree with everything. The idea behind a committee meeting is to have an analytical discussion as to how we can improve a piece of legislation, not get into political, rhetorical diatribes as we saw.